Welcome to this explainer. Today, we are jumping right into what I like to call a genuine medical paradox. Imagine a surgical tool that destroys unhealthy, infected tissue, but at the exact same time, literally heals the wound from the inside out. Now, imagine that this tool isn't some high-tech laser or $1 million robotic scalpel. No, it's actually an 1,800-year-old piece of medicated thread. It's called the Kshar Sutra, and it's out here performing modern surgical wonders that continue to totally baffle and impress the medical community today. 98 to 99%. No, that's not a typo. That is the actual documented success rate of this ancient Ayurvedic parasurgical procedure. For notoriously difficult to treat anorectal disorders, achieving a near perfect cure rate with only a 1 to 2% recurrence, well, that's essentially the holy grail of proctology. And the crazy part? It's all done without general anesthesia or long hospital stays. So what exactly is this thing? Kshar Sutra literally translates to alkaline thread. Basically, it's a specialized surgical linen thread that undergoes this intense medication process. The real magic here is the simultaneous action. As the thread physically cuts through an infected tract and chemically clears out all the debris, which is a process we call debridement, it's concurrently laying down the groundwork for fresh, healthy tissue to heal the gap. It cuts and it cures at the exact same time. All right, section 1, anatomy of the chemical weapon. The sheer precision of how this thread is prepared is absolutely fascinating. It gets coated exactly 21 times in a highly specific sequence. First up, it gets 11 coats of Snuhi latex. This comes from the euphorbia plant and acts as both a binding agent and a caustic cutter. Next, it gets 7 coats of Apamarga ash, which is an alkaline agent that chemically cauterizes and essentially scrapes away the unhealthy tissue. Finally, the last 3 layers are Haridra, or turmeric powder, acting as a powerful antiseptic to kickstart that rapid wound healing. Now, you might be wondering, why exactly 21 layers? They didn't just pull that number out of thin air. This standardization was actually pioneered by the Benares Hindu University after a solid decade of research back in the 1970s. 21 layers perfectly maximizes the drug loading on the thread, achieves a completely uniform thickness, and ensures a really controlled cutting rate. Plus, after every single coating, the thread is dried in a sterile cabinet and blasted with UV light to ensure absolute sterility. Section 2, step-by-step ligation. Since this explainer is formatted in a 9:16 vertical ratio for your phone, it's absolutely perfect for tracking this visceral, step-by-step flow. Let's dive right into how this thread is actually inserted and tied. Our first major target here is the fistula-in-ano. This is for sure the most common reason a surgeon would use the Kshar Sutra. A fistula is basically an abnormal, infected tunnel that connects an infected anal gland on the inside to an opening on the skin outside. Conventional surgery usually requires just slicing this entire tunnel wide open. But Kshar Sutra, it takes a totally different route. Okay, here is the fast-paced clinical breakdown of the insertion process. Step 1, the surgeon identifies both the internal and external openings of that infected tunnel. Step 2, a specialized surgical probe is carefully passed entirely through the tract. Step 3, the Kshar Sutra is attached to the probe and pulled completely through that pathway. And step 4, which is the absolutely critical step, the 2 ends of the thread are tied tightly together on the outside. This tying action is called ligation. The end result is what the clinical texts describe as a loop formation through the fistulous tract. And that brilliantly illustrates how the treatment works. By securely tying that knot on the outside, the surgeon applies constant mechanical pressure directly onto the infected tunnel. It's essentially a tightly gripped snare, and it begins working the very second the patient stands up. Moving right along, our second target is piles, also known as hemorrhoids. The tying technique we just talked about adapts beautifully for this entirely different condition, but the aggressive action of the thread shifts just a bit. This time, instead of threading it through a tunnel, the surgeon takes the base of the hemorrhoid mass and transfixes it. They then tightly ligate or tie off the Kshar Sutra right at the base. This completely, 100%, halts the blood supply to the mass. Because the thread is heavily coated with those highly alkaline herbs, the tissue is essentially strangled and chemically cauterized at the same time. Within 5 to 10 days, the dead tissue just simply sloughs off. To put a precise clinical term on it, we call this ischemic necrosis. Basically, it's the intentional strangulation of a blood vessel leading to tissue death. But because of the turmeric and the alkaline ash on the Kshar Sutra, the site where the mass drops off is already largely healed and disinfected. It minimizes bleeding almost entirely. Section 3, the chemical C-tone action. So what happens when the patient goes home? Inside that tied loop, 4 actions are happening simultaneously, making this vastly superior to a standard surgical knife. Mechanically, the tight pressure slowly cuts through the tissue. Chemically, the alkaline herbs cauterize and dissolve the unhealthy tract. Antimicrobially, it ensures continuous drainage so pus doesn't build up, which is a massive factor in preventing infection. And finally, healing. As the thread slowly cuts through the top, healthy granulation tissue immediately forms and fills the gap right behind it. But the thread doesn't just stay in there forever. To maintain that high chemical potency, we use what's called the railroad technique. Every 7 days, the patient pops into the outpatient clinic. A fresh Kshar Sutra is tied to the old one, and it's simply pulled right through, replacing the exhausted thread in a matter of minutes. No hospital beds, no new incisions. Which brings us to the numbers 7 to 10. This represents the unit cutting time in days. To put that into perspective, it takes exactly 7 to 10 days for the Kshar Sutra to cut and heal just 1 single centimeter of infected tissue. So if a patient has a 5-centimeter tract, the entire healing process will take about 40 days, just slowly and safely shrinking week by week. Section 4, ancient medicine versus modern surgery. Conventional surgery for these conditions often requires a hospital stay, it carries a 10 to 30% recurrence rate, and honestly, most terrifyingly, risks damaging the anal sphincter, which can lead to permanent incontinence. Kshar Sutra, on the other hand, it's an outpatient procedure. Sphincter damage is incredibly rare because the slow cutting actually allows the muscle to heal behind the thread without losing any integrity. And with a recurrence rate of just 1 to 2%, it is absolutely no wonder institutions like the World Health Organization explicitly endorse it. So that brings us to a final provocative thought for today. We've seen how the standardized preparation of Snuhi, Apamarga, and Haridra creates a surgical tool that simultaneously cuts, cleans, and heals, literally outperforming modern scalpels when it comes to sphincter preservation and recurrence rates. It leaves you wondering, if a simple 1800-year-old medicated thread can achieve a 99% success rate today, what other incredible medical marvels are quietly hiding in ancient texts, just waiting to be validated by modern science?